Welcome, everyone. This is the fourth and last seminar in the Disability Across Disciplines series for the fall 2021. So we're delighted today to have Larry Farmer, Henry Davis, and Jana Heyman present their research project called In the Forefront, Assessing Public Housing Needs for Persons with Disabilities. So just a couple of housekeeping notes. We have captioning, live captioning available. So you can choose to see the subtitles. And this seminar is recorded. The Q&A will not be recorded, but the seminar is. And if you have any clarification question, I think you're welcome to jump in with your clarification questions. But for other questions, maybe we'll leave it for the last 20 minutes or so for our Q&A, right? So, so you have the floor, Jana, Larry, and Henry. And thank you so much for agreeing to present your work.
Thank you.
Thank you very much.
Yes. So good afternoon, everyone. Jenny, you gonna put the slide up now?
Yes.
So our first slide up for us. Okay. All right.
Oops. And do you want to start, Larry, with your introduction? And
yeah. Well, good afternoon, everyone. My name is Larry Farmer. I'm one of the faculty here in the Graduate School of Social Service and had the opportunity to work with a team on this particular project that we'll be sort of discussing this afternoon.
And I'm Jana Heyman, and I'm also part of the team. I'm a professor here at Fordham GSS, and I chair the Ravison Center on Aging and Intergenerational Studies. Henry?
Yes, good afternoon, everyone. My name is Henry Davis, and I work in the Ravison Center as well, Director of Programs, Research, and Evaluation. I work directly under Jana, and it's my pleasure to be here today and present our research.
So let me just give you a little bit of the background of this particular needs and asset assessment. Where we'll be talking about the results, particularly with those participants who happen to self-identify as having a disability. I mean, this was a project that was a partnership with a community center right here in New York City, right in our backyard. I mean, literally behind and a block away from Lincoln Center, the Lincoln Center campus. And it is a joint venture where we engaged community residents, we engaged staff who staffed the sort of community center to work on this particular needs assessment, this needs and asset assessment. The goal of it obviously was to identify areas of need along with the resources that currently exist in this housing development to support the families, the children, the older adults who lived in this particular housing project. This housing project serves approximately 1,200 families. You can go. The goals of this project to understand the needs and challenges of public housing residents with a focus on individuals with disabilities and the needs of the community center that served them. We wanted to provide residents with an avenue for input into various social service programs, employment, educational, recreational, health programs, all with the goal of improving the quality of life of those who lived in this particular community. We want to provide the center with a clear set of data and a community analysis that would again inform their future funding and their future program development. A little bit of the background, geographical and socioeconomic background. Again, this is a public housing community that's located in New York City. It, like many of our communities in the city, it sits within the context of a larger community of Lincoln Center, which is a fairly wealthy community. So you've got this community of low to medium income individuals who are sitting within the context of a community that is a fairly wealthy community. Access to affordable food, recreational, quality education, and a variety of services represent a need for this particular community. Poverty, insufficient health care, family stress, environmental stresses from building neglect, which we visibly saw while we were working there. There's been this ongoing project of renovation that has literally surrounded some of the buildings with nothing but scaffolds, so and you can see the neglect, the physical neglect that this community, these residents have experienced. Next slide. So I'm going to talk a little bit about the methodology that we use. We use a mixed method design. We engaged in quality research activities where we engage focus groups of community residents, along with staff who provided services in the community center. We also engaged in development of a survey. So we utilize a cross-sectional survey design. We distributed the survey randomly. Let me say again that a part of this process along the way was to engage staff, to engage residents in the entire process. So they helped in developing the survey, provided feedback on the survey to help to shape it. So we distributed the survey randomly to selected households within 14 large buildings that represented this, the complex. Flyers were also posted in the halls announcing the dates and location where they could walk in to complete the surveys. Right? The surveys were distributed and made available in both English and Spanish. The strength of this methodology, we believe, has to do with the fact that we utilized in-depth focus groups along the way, not only to collect some of the needs and asset information, but also to support the development survey. And that the survey, we eventually able to survey 300 community residents, again, to capture their needs and their insights about the various assets, as well as needs that this community presently has.
Okay, so thank you, Larry. The qualitative research design, as Larry mentioned, that was part of the mixed methodology. Focus groups were held at the community center. This is important because you want to make sure that you're going to the place where people convene and gather as many diverse voices as possible. You want a strong representation of everyone in the community, and also hearing what they need and what they want to share in regards to their experiences of living in that housing, as well as the programs that they believe they would like to see in the community center. The focus groups are open to all public housing residents age 18 and over. Transcripts were subjected to multiple qualitative coding cycles for thematic consistency. The first cycle employed was inductive or open coding. So after we gathered the transcripts from the 5 focus groups, which again ranged between 6 and 8 participants, we had a group of researchers look through the transcripts and do a line-by-line reading to make sure to see if there were any sub-themes or anything that was popping off of the page that we noticed throughout the other transcripts. So what we're doing here is looking for a common thread or common threads in the first part of the coding cycle. So you want to see, is somebody having the same experience over and over again? And it's just not with this one focus group, but throughout all 5 focus groups. So again, you're looking for themes or tangible ideas that just go throughout all the transcriptions. The themes uncovered during this analysis included, again, open and focus coding. Now, with focus coding, that's the second part of the qualitative analysis cycle. So in focus coding, what you're doing is you're taking all these sub-themes and then you're looking for commonalities within all these sub-themes. And what you're doing is that you're filtering them and you're condensing them into larger, more tangible themes. Next slide, please. So after doing the coding and again, finding group consensus, anytime you do any sort of coding activity, you want to make sure that there's no groupthink, that you're the only one imposing your ideas on the focus group findings. So the research team met again, and through our consensus building, we came up with these the following major themes. Now, the first theme was yearning for home and community. Again, the importance of home and unity amongst residents comes from the deep roots in the community, with many having spent their entire lives in the public housing community. That's what we found throughout the stories, that the people that were living in the housing development, it was generational housing. It wasn't that people just found, some people did, but for the most part, there were deep roots within the housing development, which really made them a very close community. And again, yearning for that community, looking out for everyone, especially younger people, older people, and people with disabilities. That was extremely important to those who were living there, that they wanted to make sure that everyone had a voice, everyone was taken care of. Theme 2, appreciation for diversity. Cultural diversity and the inherent richness each distinct group contributes to the surrounding community. I think of many stories from the focus groups, one being the importance of sharing other people's culture with the youth in the community to build that respect and that understanding of this inherent richness. So there was, I believe, one who said that, they want their child to know about their neighbor's culture and share in that. Because when you do share in culture, it's inclusive, it's helping people to understand, and that is what really this appreciation is all about. Cultural understanding, as one participant stated, the more we educate our kids, the more we can stop hate. See, my kid could learn about your culture via celebratory events, then they get to learn, then more people, then it all comes together. And I think that's just a great quote showing how it is such an important part of living in this community. Theme 3, conditions supporting human dignity. The need for a safe, clean, and welcoming environment where residents can flourish without anxiety over unsafe living conditions was frequently expressed during focus group sessions. Now, I think as what Larry was saying, that you see, especially if you visit the housing development, you'll notice that the scaffolding that's been there seemingly forever. There were complaints about people walking their dogs in the hallway and unfortunately leaving droppings. And you hear some of these stories that people, especially the older population and vulnerable populations, are actually afraid to sometimes leave their apartment, especially during certain times of the day. So you see from that, and you hear from that, that not everybody has that chance to be part of the community or let their voices be heard, because they're kind of confined to their apartment, where they should be out and enjoying the community and getting the resources that they need. Next slide, please. The theme 4, continual growth of programs and affordability. Importance of enhancing childcare programs, especially considering that many working parents rely on such services. This was expressed with individuals without disabilities, individuals with disabilities. This was considered important, having programs for younger people and for families. And as you know, childcare can be quite expensive. So it could be very taxing for working families to pay outside of the community center for this childcare. So that was a program of importance. It was also seen as developing the family and also allowing, again, those working families that peace of mind, knowing that their children are being taken care of. Expanding opportunities for seniors and other groups to bond with each other over leisurely activities such as bingo and Pokino, as well as host speakers on health-related issues such as proper nutrition. Those were, I believe, rated high by both individuals without disabilities and individuals with disabilities. The importance of programming, the importance, again, of bringing people together, because when you have that strong, cohesive unit, others can advocate for their neighbor that might not be being heard. Again, affordability of programs was discussed. The community center, now this might be an issue in regards to communication, because the community center does offer a lot of programs that are free of charge. But with that being said, if people aren't aware of that, then that creates a problem. So even though we heard from the community center that they do have a lot of programs that are free, understanding that that might not be being communicated to residents is important to know. And then the last theme, theme 5, an emphasis on trust. Building trust with internal and external stakeholders considered crucial for effective change in the public housing community. There were many, and again, even though this was a needs assessment for a community center, people would talk about their experiences in regards to living in the housing development. And a big thing was, that they would complain about something or they would need something done, and then people were not getting back to them. So before anything, before you can build programs, before you can have that flourishing of activities for other people, there needs to be trust. People need to believe that you are sincere and that you are going to advocate for them, and to ensure that all people without disabilities, people with disabilities, younger and older adults, are going to be taken care of, so that when you say something, it actually is going to happen.
And one of the things that we looked at was also, besides what we heard from the stories from the focus groups, we ended up using a lot of that information to help us understand more in developing the cross-sectional survey. And the purpose of this, there was a very small amount of funding to the agency to find out more about what services were needed and what services were seen as assets in the community programming. So we used the words and the wisdom from the focus groups, but also, as Larry talked about, was we really engaged participants that were the life and involved in the community to help us. So the tenant association and the leaders of the tenant associations also helped in discussions and planning for the survey. And I think it was very valuable because it provided the rich and diverse questions that were developed, and also questions that we felt, often as researchers, we think are very clear, but having a group of people that are involved in the community and have been part of the community helped to really reframe some of this. So questions about assistance, community services, education, youth programming, children and families, and other age-focused programs all came into that part. We did look at using what they saw were very needed and not needed. But interesting enough, we really did reach out, and I think Larry, shared with you a lot of how we expanded the outreach to all parts of these 14 buildings. So we were there in the evening, we were there in the morning, we were there at the daytime, walking throughout the community, walking with the scaffolding, and some on some of our tablets, of course, there was a lot of dust because that is what many of the residents are living with. So to understand their environment, we really wanted to be part of that, and to be there at all different hours and be available to get community residents insights. So we did look at the whole idea of understanding if people had disabilities, and while that was a part of this project, we also included other areas, but we thought it was very important to understand the array of people that did have a disability, which represents about 28.3% said they had a disability. They tended to be older people with a disability, more likely to be female, more likely to be African American, Black. For respondents with a disability, we tried to capture what they saw were some of the priorities. And I think, the whole idea about community cleanup, living in that environment was very important to many individuals. And also the importance of age-focused programs, as well as education, health. And I think that is very important. But as we heard from the focus groups, and we saw this again when we were involved in this and when we saw the data really unfold, is that maybe somebody was older. They wanted still activities and programs for teenagers and younger adults. And the stories they would tell us in some of our open-ended responses was that this is a community. Whether the scaffolding is here, whether we don't have enough opportunity to maybe engage with all our community members, they felt it was a community for young people as well, even if they saw themselves of not having children, not having teenagers or young adults. They felt it was important to engage and be involved in opportunities. So we did give you just a snapshot of what the needs for people with disabilities who are self-identified was. Again, neighborhood cleanup, program activities for seniors, health education, mental health counseling, and fitness. So the health and mental health came in as some of the higher ratings and some of the concerns, as you can see from the rankings. And again, also issues of crime awareness, programs for teens, and low cost space. I know that may seem surprising for all, but the community is often viewed by many people as a place where you could get together and have an event. And I didn't understand that, to be honest, when we first started this project, but they felt like it was their community and that they should have the parades through the community area. They should have opening of rooms that in the center that would be available for special events, family events, and so forth. And then areas of family support for relationships, as well as other recreational opportunities. And then for people that did not have a disability, just to get a snapshot, there was a different focus, more on employment and jobs. However, again, program activities for young people came up very high, very similar to what we saw identified for individuals with disabilities. But again, jobs came up. This was, I think, very pressing for many that identified skills, and job training is very important. We heard many stories how it's very hard to apply for a job, to get access to get into the computer room, how to get the computer and the resume so that you could apply for a job. So we heard many of the real life stories saying that jobs and employment was so important. And again, recreation came up, very similar for all populations, as well as concerns about financial information and really enhancing one's educational understanding of where they could be to attend school and colleges. So we saw a lot of limitations with this, with what we did, but we also saw some richness. And I'm just going to focus on the limitations and then turn it back to Larry to expand on the next part. But the focus groups did not capture probably as much information because everybody was participating, so we did not have as in-depth information about disabilities and disability services. And again, remember, it was a cross-sectional design, which only gave us a snapshot. And we do know that when people are doing and involved in surveys, that people may not self-identify due to a stigma related to disabilities. And we ask people to identify. And so that also came into it, the limitations. And lastly, that due to time constraints, some people didn't maybe not give an account of all the needs or assets, or may have not always filled out some of the open-ended responses because they were on their way to work, or they had to get back for, childcare. I mean, then we had the extremes where many people did not want to stop talking about their stories and their lives. I have to say, it was just an honor to be part of this project, but an honor to listen to those individuals that wanted to elaborate. So I say some people, time constraints, where other people felt like this was an opportunity to share and to really, engage and feel like their voices were heard. Larry, I'll turn it back to you. Oh, I think the mute button is there.
Yeah, I also want to say that it was a pleasure to do the survey piece. I didn't participate in any of the focus groups, but I did participate in some of the surveys that we collected. And it was a pleasure to, in many cases, stand with individuals. And while they're completing a survey, they're also telling their stories, especially some of the older adults, who some of them had disabilities, but who had seen sort of a history. They had a long history with the community, and they could talk about, what they see as a need based on what they understood about the way the community used to be and what used to be available. So I thought that was sort of interesting and very enlightening to the surveys, to also have people tell their stories about their life in this particular community. So in terms of some of our discussion points, as we looked at both the qualitative and the quantitative data, one of the discussion points, creating health and community-rated services centered around residents with disabilities to promote better quality of life. That was clearly something that came out as an important, sort of need the community had, was to, again, work to bolster both health-related services, but also career-related services. The concern for the well-being of the younger residents and older residents, their concerns for those with and without disabilities, right? And the well-being, that sort of came up, is that both those with and without disabilities expressed a lot of concern about what was being available for the younger adults in terms of recreation. This is where we got stories about, what used to be available to the teenagers over the summer, the different programming that was used to be available to them that's no longer available to them. And they're really recognizing that was an important element of the development of the youth, of their own experience, and many of them developed as youth in that community. The neighboring communities and organizations that have a means and influence to leverage those resources to advocate alongside with the low-income housing residents, right? With and without disabilities, right? So the idea that, again, this is a community that, while there may be a lot of lack of resources within that particular housing project, they're sitting in a larger community where there are lots of resources. And this sort of came out, I think, in a lot of the discussions with some of the leadership in the community residents, those who were leaders in the resident groups in the community, the need to begin to leverage those resources that exist outside of the community to then provide more resources for those in the community. And the last sort of discussion point, defining the neighborhood community center's role in providing support for both residents. That was one thing that sort of came up, that many of the residents didn't always know about the role that the community center actually plays in its relationship to the housing project. and the housing authority that is over the physical environment there, and clarifying that role. Also, in clarifying communication about what services actually are available in the community center, because in many cases, residents would express a need for a particular service that, in fact, when we talked with those who were the staffing at the community center, they said, we do have those services, or we have provided those services, and we've sometimes not get the kind of response from the community that we would have anticipated. So we saw that as sort of a lack of or difficulties in communication between what's available, what role the community center plays in relationship to the housing project and the housing authority that is responsible for the housing project in which they physically live in. So those were just a few of the discussion points that we had. Okay. Some conclusions. Again, this research did provide a clear understanding, limited as it may be in terms of the time frame that we were doing the study, of what the needs are of this community, as well as the aspirations, right? And again, it was really very encouraging to see that so many of our respondents with disabilities, without disabilities, our older respondents, were really concerned about the needs of the community as a whole, younger adults in particular, and really building up resources to support those needs. Residents with disabilities are looking for a sense of community, right? They're looking for this to be, again, and you heard this in the older adults, this to be the kind of community that it was in past days, where they had opportunities to come together, to have block parties, for example, to have some of these outdoor events they would have during the summertime that bring people together. What's interesting is that some of what has happened to prevent those things is in part due to some of the construction that's been going on there, right? So they've had construction not only around the buildings for seems like decades now, but also some of the outdoor areas have had constructions, and they've had that be something that's been a barrier to them doing some of their normal outdoor activities, community activities. Empowering residents, empowering their voices, the ability of the community, of the residents with disabilities to communicate what their needs are to the housing authority, to the community center. That is an important conclusion that we can draw. And last but not least, we found this partnership between the university and this nonprofit community organization that is providing services to be an important vehicle to help lift up opportunities to empower and bring the voices of residents, to the forefront in some of these discussions about providing services and helping to support the community. So we really, found this to be a very valuable sort of partnership,